We are going to discuss power, influence, and empowerment. Power is the ability to influence others, and empowerment is the process of sharing power with others so that they are able to exercise their own power or influence. And it's really important to empower your staff. It encourages them to be creative. It lets them know that you have faith that they can do things, and it's unbelievable what your staff will do if you empower them versus micromanage them. Strategies for a powerful self-image. First of all, self-image is presents a posed and a positive image to oneself and to the rest of the world. Exercising power requires the nurse to feel powerful and to think of oneself as powerful. Nervous Nellies and disorganized Dans do not project images related to power. Grooming and dress are critical to a powerful image. Dress for the situation. Neat scrubs are appropriate for the clinical area, not for other settings. At the bedside or in the boardroom, looking confident and powerful is shaped by the nurse's clothing and grooming. You don't get a second chance to make a first impression. Hair, makeup, and jewelry should be appropriate for the situation, and clothing must look professional and appropriate to the setting. Business casual is not an invitation to wear jeans. Attending a professional organization meeting, a conference, or a luncheon meeting is not an excuse to dress down. Speech is a powerful aspect of your image. Pay attention to your tone of voice, pace of speech, and volume. The words of one says are important, and how those words are spoken is even more important. At least 90% of our message lies in how we speak it, not the words we say. Tone of voice, pace, and volume are important, as is the pitch of one's voice. Some leaders do well to take some vocal coaching to ensure that the pitch, pace, and tone of voice are perceived as powerful. Your body language is critical to your position. Body language communicates volumes about us. Gestures that are too dramatic are viewed as hostile. Postures must be relaxed but not sloppy. Stand tall and erect. Make eye contact with others. I think it's important to watch the cultural video, what different cultures think about eye contact. In large, an audience makes contact with different people as you speak, and you're sweeping your view around the room. If standing, do not act as if you're standing above others. That can be interpreted as hostile. Believe in yourself. The power is a positive force for nurses. That being a powerful nurse is a professional asset and is critical to one's positive professional image. You must believe in oneself, one's values to an organization, and necessary skepticism are necessary to fulfilling the commitment to project a powerful image. The profession of nursing. Nursing is constantly rated as the most honest and ethical profession in the world. Sometimes nurses are their own worst enemy with self-defeating attitudes and a failure to promote their profession. It is critical to value nursing as a profession, not just a job, and to view nursing as one's career, not just a job. Never think of one as just a nurse. Never discourage others from considering nursing as a career, and be a booster for nursing. Project that nursing is a fabulous profession to be in. You also must continue to learn every day, and one way that you can do that is through continuing education. Never stop learning. Many states mandate continuing education and a certain number of CEUs every 2 years. Continue your academic education in nursing and seek to get your graduate and doctorate of education. I encourage each and every one of you to think about going on beyond your BSN and getting a master's degree. It just brings opportunity to you and opens a door in the nursing profession. Your attitude is important towards others. Be honest. It's critical to professional behavior. Be courteous even when others are not. Greet patients, family members, and colleagues with a handshake and eye contact. Sometimes being courteous to those who are rude and demanding is difficult, but being a professional demands courtesy even in difficult situations. And take the time to smile. Smile when appropriate. Smile puts people at ease, especially when they are under stress. We all feel better when those around us smile. Frowning can be interpreted as disinterested or disapproval. Take responsibility for your mistakes and what you learn from others. This is a profession of accountability, and it is powerful. Some of the most powerful learning that will happen for you and I occur as a result of mistakes. So, in essence, it's okay to make mistakes, but what is most important is that you learn from them. Be a risk taker. Step up to the plate and work with others to solve problems of an organization in which you work, the organization to which you belong, and the community into which you live. It is important as a nurse to network and mentor others. Networking, join nursing organization, get to know nurses outside of where you work. You never know when you might need to call upon your network. Be proactive in sharing business cards with those in your professional network. And be willing to mentor others. You once needed mentored, and so take what you've learned, and as you grow into an expert nurse, take the time to mentor the young. They need you, and the profession needs you to mentor. Join your state nursing associations, state affiliations such as American Nurses Association or a specialty nursing organization. And don't be afraid to find yourself a mentor and to reach out to gain from their nursing experience and expertise. As a leader and as a manager and as a nurse, we must be able to accept criticism. Feedback is critical to our success. Learn to differentiate between constructive and deconstructive criticism and learn from both kinds. And I always say with deconstructive criticism, that helps you learn who you don't want to be and work towards being that professional that you want to be. Are you politically astute? And I'm sorry that you can't see the writing on this slide, but what it says is self-assessment. Are you a registered voter? I know where my voting precinct is located, the names of my senators in Washington. I know the name of my state senator from my state senator from my district, and I know which senators are supportive of nursing. Political astuteness at both the state and federal level is critical skills to cultivate. Read about politics and policies that matter to nursing in nursing journals and professional organizations. Learn about policies and politics in nursing, and I challenge each one of you to do that. Build your political skills. Build a relationship with your legislator. Be an active member of an organization. Run for office. Develop expertise in shaping policy and seek appointed positions. In conclusion, I challenge and encourage you to become an active member of a selective nursing organization, to develop a powerful and personal and professional self-image. Invest in your nursing career by continuing your nursing education. Make nursing your career, not just your job. Develop networking skills. Seek out a mentor. Be visible and competent in an organization in which you work and network. You can make a difference.